My grandmother was diagnosed with breast cancer when I was in high school, actually, and that was kind of over time when I was trying to figure out what I wanted to do with my life. And getting to know her doctors really inspired me to go into medicine. Hi, I'm Dr. Gary Eastwick. I'm a radiation oncologist at MD Anderson Cancer Center at Cooper. I'm a GU radiation oncologist, which means I mostly see patients with prostate and also bladder cancer, other types of genitourinary cancer. Also, I see patients with gastrointestinal cancer and some other cancer types as well. Modern technology allows us to be very precise with our radiation and to target the areas that we intend to and spare as much as possible the healthy tissue around the cancer. One of the ways in which we can do this is to use our MRI radiation machine, which is in Mount Laurel. The MR Linac allows us to use an MRI during treatment to actually visualize the target as the patient's receiving their radiation. This allows us to ensure that the radiation is going where we intend it to go. We take a very personalized approach to each patient, each diagnosis, and especially for prostate cancer, not all prostate cancer is the same. Some is very aggressive, some is not, and it really depends on the specifics for that patient, what the options are, and what makes the most sense. But one of the best parts of my job is helping people decide what the right treatment is for them, not necessarily what I think I would choose if I were them, but helping them to decide what makes the most sense for them. I'm usually not the first cancer doctor that a patient meets, and so they've had a little bit of an opportunity often to sit with their diagnosis, and they have a lot more questions at that point. And so my favorite part is really helping them to really process and understand what the cancer diagnosis will mean for them and going forward. And many of the cancer patients that I see will be cured, and that's usually the first thing I tell them. And that's really a joy for me to be able to see their reaction, the relief on their faces when they hear that. But as a doctor, I'm also very realistic, and not everybody will be cured, but even those who can't be, I usually can help in some way. And that may be as simple as helping them to cope with their diagnosis. The most rewarding part of my job is to turn fear into hope, and we can do that every day.